Welcome, Dr. Zameer Brey, to my podcast, Abantu for Ubuntu. Thank you so much for joining me. Dr. Zameer Brey is many things. He's a prolific leader in anything to do with health in South Africa. He's the chair of the hospital board of the Groote Hospital, where, of course, which is very famous in South Africa. He is a TB program lead for the Melinda and Bill Gates Foundation. He's a director on the board of the OHSC, which is the Office of Health Standards Compliance, as well as a lecturer at UCT at the Graduate School of Business. I think the list goes on and on. Thank you so much for joining us here today, Dr. Zameer Brey.
Thanks, Kim. Thanks for having me. I don't know about those qualifications and titles Kim has mentioned, but happy to be here for this discussion and looking forward to a good conversation.
The series is called Abantu for Ubuntu, which roughly translates to people for Ubuntu. And the spirit of Ubuntu, of course, is the feeling, really South African or Southern African feeling of humanitarian efforts and belief in the sense of community where I am because of who we are. And I really feel a lot of what you're doing is so true and really speaks to that.
Kim, just a quick one, because, I know this is a bit impromptu, but I actually really like your framing, because one of the things I think that we are learning about this COVID epidemic is that it's actually the opportunity for social cohesion and physical distancing. I think we've been speaking too much about social distancing. It's actually social cohesion. I think it's the coming together and physical distancing. And it's a theme that's been playing through my head since the start of the epidemic, which is actually we need to get closer to each other, but further apart in person.
Absolutely. You're so on track. I can completely relate to that. In our team, I haven't met half the people in real life. Like, we did a social evening yesterday, and I don't know if I would recognize them if they walk past me, like in the shopping mall, but they're incredible human beings. And we've been working together for a few weeks now. And I think that so many organizations are finding that, or connecting with family members that you haven't connected with in a very long time,
Yeah, absolutely.
Yeah.
Absolutely.
So I was on the website for the Gates Foundation, and I love the slogan, like, all lives have equal value, and we are impatient optimists working to reduce inequity. I love that description, impatient optimists, and certainly the interactions that I've had with you, you certainly seem to fit that description, and I really, I think that the Gates Foundation has really established itself in the world, even pre-COVID, in the preventable diseases space, and obviously now even in the COVID space. What are your thoughts around that, and how do you perceive, what are your thoughts around that currently, in general, as an impatient optimist?
Yeah, I mean, I think I still feel the same way I felt when I joined the foundation some 4.5 years back. Just a real gift of opportunity to be surrounded by folks with the kind of intellectual horsepower, passion, and singular vision. All kind of converging towards making an impact in the world and serving the most vulnerable. I think that the vision of the organization actually lives through in the way people engage, in the way people show up in the foundation. So I feel extremely privileged to be part of a team that has the kind of almost the breadth of expertise to take on really tough challenges and really enjoy doing that. So, one of the things I almost feel at the foundation is folks like really tricky problems. They like, things that are complex. They like things that, and you'll see that from our co-chairs. I was watching the Netflix documentary over the weekend with Bill Gates, and Melinda actually describes Bill as the person who likes complex challenges. Don't give him something easy. And I think in many ways, like, there are folks at the foundation that enjoy and revel and shine when they are given these really tough problems. How do you eradicate polio from Nigeria or Afghanistan? How do you, drop the incidence of TB in China by tenfold? Those are all, really big kind of hairy problems that the world is facing. And I think what's been incredible is that there's this combination of really kind of smart people. I don't consider myself one of them, just to be really clear.
And humble,
I still find I think I'm really lucky to just be there, but really smart people with the drive and passion, and then obviously behind them are the resources to try and make a difference. And so, very often, and also I think what's really important and I think different about the time at the Gates Foundation is there isn't a sense of trying to leave kind of our emblem or our stamp on anything. In fact, it's completely the opposite. I've been in so many situations where our team goes, take our name off the slides, take our name off this event. We don't need the recognition. We need to give the recognition to the people who matter most: government leaders, patient advocacy groups, research partners, etc. And so that's actually a very empowering position to be in, because it transfers the ownership and the credit to those who, really kind of deserve it and need it. So I think just at the organizational level, what that's given us is the ability to take risks where other partners can't take risks, to do things that may be considered kind of slightly weird, but necessary, but with the intellectual rigor and kind of calculated risk on, what are the big things that we need to solve with partners around the world.
Absolutely. Yeah. Absolutely. And have you met Bill Gates?
I have indeed, a few times. In fact, Bill's been to South Africa several times. In fact, he was here earlier this year, right? He was here for the tennis match, and it's fantastic. He met a few folks here in South Africa. He's met with government partners on several occasions, and South Africa is an absolute flagship geography for the Gates Foundation. For many reasons. I think the HIV burden, the TB burden, but also an aspect, Kim, I hope we will get into, which is in many ways South Africa is the drinking fountain for the foundation when it comes to innovative ideas, concepts. And so we have a stream of teams in health, in water and sanitation, in financial services, in digital innovation, in agriculture, that do all of the R&D investments here in South Africa.
Yeah.
This is absolutely a melting pot for ideas that get exported to the rest of the continent and globally. And I think it's a massive accolade for the researchers, the implementers, the government of South Africa, that a lot of what's happening here is influencing and changing the global kind of narrative and practice.
Yeah, absolutely. I was watching Trevor Noah interview Bill Gates, and he said, "Oh, I just got off the phone with Cyril, and things down in South Africa." And I was like, "Wow, this is kind of cool." Like, it really does seem like, as you say, that there is a rooting in South Africa, and I mean, I feel that for me, South Africa is a melting pot. Sometimes focus is the most difficult thing, because there are just so many cool things happening and so many innovations, and I struggle with focusing sometimes on like what's the best, what's the most important thing. But yeah, and I mean, like I I mean, I love the fact that, you know, that you're so involved in the health sort of community in South Africa. And you, as I mentioned earlier, you're heavily involved in Groote. How are you seeing like healthcare workers' role during this time? I mean, in general, I guess when you're talking about things like, you know, eradicating polio or bringing down TB, but especially now during the time of coronavirus, how are you seeing, like, I mean, the South African community of healthcare workers, like what's happening there in the space that you have contact with?
Sure. And I do want to acknowledge it is probably one of, if not the biggest test for healthcare workers, as far as I can remember backwards, and maybe for the next 20 or 30 years going forward. I mean, I think that we must, as the general public, acknowledge the sacrifices that healthcare workers are making on the front line. And I'm referring to everybody from the cleaner, the porter, the nurse, the dentist, the pharmacist, the physiotherapist, the social worker, the doctor, the specialist, have made huge sacrifices in terms of putting aside their own anxiety around COVID, the risk to their families, the fact that they are seeing their own colleagues suffer and even die, you know, of COVID. I think it's been a particularly difficult period. And you know, organizations like yours are really making a big difference in trying to help what is a difficult situation with very tangible support. I think there's also an amazing upside that's emerging here. I am seeing, and I'm talking, you know, apologies if I kind of get a bit emotional on this one, but my own doctor is in hospital right now, and he's not doing too well. And, you know, it's starting to hit home because somebody we know in our own circle or in our next circle has passed on from COVID. But I think that what is emerging is a really kind of powerful narrative where the acknowledgement of the role that healthcare workers play in society is actually coming to the fore. And so I've seen messages of support, praise, services being held in praise of community healthcare workers, of doctors, of nurses across the country, saying, you are really our heroes. You are doing everything possible to help us. And it's fantastic. I mean, I think that, you know, healthcare workers across the spectrum, inside hospitals, outside hospitals, are like being elevated and are being labeled the unsung heroes of the COVID response. And so I think that, you know, in this time of difficulty, in this time of kind of adversity, there is really a silver lining. And I would say that silver lining is, you know, part of kind of recognizing the critical role that healthcare workers play in advancing and getting us through this epidemic.
Absolutely. I mean, I feel you 100%. My granny passed away on the weekend, and her old age home had COVID, and you know, it was she was very old and like and you know, and she lived an amazing life, but at the end of the day, like, you know, when COVID reaches an old age home, and especially the like intensive care unit or the frail care unit, like it, you know, it is so tricky. And by a miracle, I was allowed in to be with her because I had COVID, and obviously, you know, so they made an exception.
Wow.
You know, and in a way, you know, it opens up my mind to a whole new, you know, like what does it mean to have had COVID, and kind of and now, yeah, like I was watching the nurses in the unit, and how they were treating the patients with so much dignity and so much respect, even though they must have been terrified. Like their colleagues were every day, another one was positive, and like you know, all the a lot of the patients you know, had it and were dying of it because they was in the intensive care, and they were so brave. Like, I just stood back and I was like, you know, in theory, I say healthcare workers are brave, like as an idea, but like when I'm looking at you right now, like standing in front of me, I'm just like, wow, you know, just to like greet that, just to like come to work every day, and they were like so positive, and meanwhile, it's such a terrifying experience, you know, to be in a situation where everything's like a ticking time bomb, but they were just amazing. I was like, it was a very profound experience.
And Kim, you know, I mean, you know, I've been looking at the stats a little bit, and just in the Western Cape. So part of my role is I've been seconded from the Gates Foundation to support the Western Cape government. There are about 62 healthcare workers being infected every day. And we know, you know, a number have already passed on. And in some ways, I almost feel like what you describe is the modern day battlefield, right?
Yeah.
So like our healthcare workers are pitching up. They're not just pitching up. They're showing up with so much courage, so much commitment, that I can tell you without a doubt, healthcare workers have completely disregarded what was on their job description and have stepped in and said, what is needed in this situation? And I will do this. I mean, we have specialists, okay, neurosurgeons or neurologists or, you know, etc., that have kind of parked their speciality and said, what do you need me to do in this situation? I'm not trained for it. I'm scared because I haven't ventilated a patient, but I can see that as our hospitals fill up and the demand far exceeds the supply of people capable to do this, I will shift and change and chop my job description to make sure I can help the patient in front of me. Nurses have done the same. You know, all cadres of workers are like basically disregarding what the paper says and stepping into that fray and saying, I will help. I will give of myself, regardless of the risk. Yeah. That's so selfless.
Totally, totally. You know, I watched a video a few weeks ago of like somewhere in the US where you know, it's at the moment I feel a tension between the health crisis that you're describing and then the economic crisis, which many South Africans are sort of feeling very emotional about. I feel like there's varying emotions: anger, disappointment, you know, shame, all kinds of emotions, and there is this constant battle between, you know, an economic crisis and a health crisis. And it seems like as the one subsides, the other one grows, and so it goes. In this video, you know, there was a group of protesters in the US, and I can't remember which city it was, but they were protesting without masks and saying, like, we have a right to be in public spaces wherever, whenever, you know, and this is our right, this is our constitutional right. And there was a video of a healthcare worker getting stuck in traffic, like just trying to get to work and all masked up and just kind of getting really emotional, saying like, I will be at work tomorrow and I'll be at work next month, and when you come in sick, like I will be there for you, you know. And also that like feeling of just going, you know, we're doing our absolute best. And I think that for me was really this like economic crisis versus health crisis. So as we know, yesterday the president announced, like, you know, loosened lockdown level 3. We can go to cinemas, we can go to restaurants soon, we can go gambling. You know, how do you feel about that? Like, how do you feel? How do you think the healthcare community feels about that? I mean,
yeah, and you know, I do think that I think we almost as kind of healthcare workers need to kind of have the healthcare interest, you know, top of mind. But there's a very real cliff that we're staring down here, and I have actually been very vocal that if we turn the kind of the dial too high up on all of the restrictive measures, that we may be able to flatten the curve a bit. But how many people will die of poverty? The jobs numbers, the unemployment numbers, on a baseline of almost 30% unemployment, in the short term, another 3 million jobs being lost, 14% of the population being pushed below the breadline, and some 15 to 20 million South Africans dependent on social grants. That makes us look like any other low-income developing country on the continent very quickly. And so I am fully cognizant of what are the kinds of things that we need to innovate ourselves out of to try and get to a position where we are able to support individuals, create livelihoods, but still have some protection in place. I also think that South Africa comes from a baseline of vast inequity. I mean, our Gini coefficient is like 0.7 or something.
Yeah.
This is probably the most obvious test of how are we going to respond to those that have and those that do not have. This is the biggest test. And so when I listen to chat groups go on about, we don't have a 100 gig line in my house, so my kids can't sit on 3 tablets at the same time and I kind of think about, what about the other 80% of the country that, let alone, they don't have the tablet, they don't have data, they don't have, and so while many of us in our kind of middle income, upper income households are kind of thinking about multiple devices and super fast internet to be able to enable a digital classroom, what about the mass? And that's true for healthcare. If you can afford today, you could probably get a bunch of things done. But the public service can't do that. It doesn't have the capacity to do that. That's true for transport. So as we perceive risk, I could say, I'm driving in my car, I'm not taking chances. But the people who don't have agency, there's no choice. It's either the train that's at 180% occupancy, or you don't get to work. And so I do think that this is going to be a defining moment for us as a society about how do we respond so that we don't end up in a situation where after COVID, our Gini coefficient is 0.9, and those that have more, and those that had very little have nothing. We have to try and find that balance.
It's such an exciting space, I must say. Like it has the last 3 months of lockdown, I have perceived them, it has been difficult for many people and for many different reasons. But I think that there's a level of consciousness, certainly I'm experiencing a level of consciousness where people are more innovative, maybe, more like, well, there's a blank space now. Let me like innovate completely, I never thought I could be a teacher to my kids. I'm not a great teacher. Let me just say it like that. But like, I never even considered it, and right. Suddenly you have to, and you're like, oh wait, I actually do know how to do long division. Ugh, and it kind of, and it does kind of make your mind think, well, if I'd never even thought of that before. And what I mean, the CANS network, I'm sure you've come into contact with them, the Community Action Network. I mean, I really think that such initiatives are manifesting and becoming a reality, which is promising, and it's an inspiration. Talking about like innovation, tell me about some things that excite you. Like what's exciting in the medical field right now? Like what innovations are like cool and happening?
Yeah, absolutely. And I do think, Kim, I mean, if there's one kind of takeaway from this particular discussion, I think that if we the biggest loss would be that in a post-COVID era, we return to doing things as normal. For me, I think it would be the biggest, wasted opportunity. And so in and amongst all the tragedy and the crisis, I think there are so many lessons, so many blessings, so many innovations coming through that we have to grab them and make them the new normal. They absolutely are changing the way they're changing the way we think, the way we do business, the way we respond. And I was thinking that, so I'd love to talk about healthcare. This is my thing, but I can talk about the hospitality, can talk about transportation, can talk about social relief. The way that the relief, the food security sector is transforming rapidly. I can tell you with high level of confidence that by the end of this year, there's going to be such a shift in paradigm around food security for this country that we kind of going to forget that we even did just food parcels as the only thing, because we're realizing that there are other tools, other innovations that are so ready to be tested, to piloted, and go to scale quickly, that give agency to individuals where they have so little choice. So rather than giving somebody a bag of 12 things you've decided are good for them, give them a little agency through a cash transfer, digital transfer, or some sort of voucher, so they can at least have a decision on the few things that they eat, or that they need to pay rent with the cash, etc. Those things are happening at a super exciting pace. In healthcare alone, I mean, so on the R&D front, I think in that first couple of weeks, I searched how many articles were published, peer-reviewed publications. And it was striking, because in the first 2 or 3 weeks of March, there were probably 700 or 800 articles peer-reviewed and published. And there was some around COVID specifically, but there was something magical happening over there. So I know there's been a fuss about some of the peer review mechanisms that failed, and all. Let's just remember, those are small numbers in the bigger scheme of things. But the most exciting piece of what's happening is that there's data sharing amongst groups that previously never shared data. Because of the crisis, people are trying to learn nimbly and in agile ways. And so what they're doing is they're very quickly sharing their experiences, formally or informally, published or unpublished. So data sets are moving across borders, moving across academic groups, implementing partners, laboratories, etc., in ways that just didn't happen before. And what that has led to is emergence of new thinking, new thoughts. I mean, right now, as we speak, even in South Africa, some of the other skills that are being brought to bear, we have actuarial scientists coming in and helping with modeling. The modelers are actually, they have a platform to speak. Previously, they didn't have a platform to speak. And so I think the rate of knowledge generation has far superseded what we've ever seen before. On some specific things, right? Like, it'd be remiss of me as a Gates Foundation to not talk about vaccines. That's the thing we're really kind of working hard on. And our teams in Seattle are super focused on this particular, tool. From a limited understanding, we probably have in excess of 100 vaccine candidates. The rate of vaccine development in itself, I know many people are kind of concerned it will only come next year. Let's just pause for a second there. Which other vaccine have we seen come to market, not through development, not through clinical trials, not through human trials, to market in less than 18 months? This will probably be the single fastest development of a vaccine to market at scale.
It's amazing.
Okay. And even on our own shores, by the way, some of these trials are being done, in African countries, which is fantastic, because again, the research infrastructure, for example, in South Africa, is exceptionally good, and so we will see some of these trials come here. But we've also seen, like, equipment. the use of 3D printers, some of the ventilators for our own response will be designed, built by our local teams.
That's amazing.
You know, and it's amazing that almost the crisis has pushed us to the point to say, where do we get this stuff? Because there's a global shortage. We need to make our own plan. Hopefully, going forward, we're going to make our own plan because we can.
Absolutely. Yeah, that's crazy. I mean, I don't know if you've seen the convalescent plasma trials that are going on with SANBS. And like, I mean, it was, my doctor reached out to me, and unfortunately I can't do it because I have had kids. So I've got the wrong antibodies and things like that.
Okay.
But like, it's amazing. They're basically taking plasma from COVID recoveries and then seeing whether they can do blood infusions or plasma infusions with like very severe COVID patients. And it's, I mean, like, I think 3 weeks ago or a month ago, it was an idea. Now they're already like, it's gone so quickly, you know, like some, and I know that there are lots of clinical trials going on. Like people keep sharing like, hey, you should take part in this clinical trial and that clinical trial. Like, and it seems like, as you say, it really is, it really is escalating quickly. My cousin is an avid reader. He's a doctor as well. And I think recently he said he's now seen that there are 3,000 peer-reviewed papers. So you can just see from like, you know, a few hundred to a few thousand in like, in 2 months, you know. And I guess that sharing of data is so powerful, you know. We've been able to, through Ubuntu beds, we've used map technology through a company called Esri that just said, here, like, here's a resource, like, here are 2 people, in fact, like, let's help you. And they just jumped on board. And now we've mapped like every single hospital. I think there are 480 or 500 in South Africa, and mapped them against the accommodation providers, you know, so you can see exactly like what's the closest hospital so that people can walk to work. And, you know, like 3 months ago, I would never have thought that like I would have access to this kind of technology, you know, and like that kind of data. And
absolutely. And I think that, you know, really, I mean, the discussions that I see, actually not discussions, actions that I'm seeing today, even in the government departments, and I can talk about health specifically, that are happening today, that 3 weeks ago, I think people would have been kicked out of the room without a cup of coffee. It just be, that's crazy, right? I mean, some of them, Kim, are, for example, there's been this notion of what does patient-centric care look like, you know, in a public healthcare system. And I think for a long time, it's been notional. It's been like quite abstract. We need to design around patients. Let's think about what's convenient, what's best for them in their own space, etc. In the COVID period, in South Africa, we've just seen telemedicine grow quickly. I mean, the space has been too constrained for a long time. And all of a sudden, what we needed to do was to make sure that we're protecting those that are most vulnerable, the elderly, those with comorbid disease, etc. Right? So the last thing you want to do is bring them through crowded public transport to crowded public health facilities. And so you really want to protect them in their spaces wherever they are. Teleconsults, WhatsApp for electronic screening. 1 million South Africans have been screened using a WhatsApp robot. Let's just pause for a minute and think about that.
Crazy.
In excess of 6 million South Africans are receiving information on coronavirus through a WhatsApp channel. That particular technology developed here in South Africa with the Gatesfoundation Foundation. We're also supporting this, but has been white labeled and exported to more than a dozen countries with more than like 20 or 30 million users. And it's just in a matter of weeks, right? So if you told somebody like 4 or 5 months ago, we should do electronic screening using WhatsApp. No. The other thing that's, you know, been a project that I've been very close to, which is like, how do we make sure that the most vulnerable population still have access to the medication? And again, even the the survey tools that we used, the Human Sciences Research Council, Stats SA, and a couple of other entities have started to use USSD technology and WhatsApp to get survey data. HSRC did a massive survey. I think it was like 20,000 participants in a matter of days. And one of the things they showed is that 1 in 5 South Africans in a settlement or in a township cannot access medication. That's solid data. We needed to act on that immediately, right?
Yeah.
So what we then partnered up with, kind of started in the Western Cape, but just happening in eThekwini, soon Buffalo City, in Tshwane, is leveraging this massive community healthcare worker network to deliver medications to people's homes, and the e-hailing technology, Uber, Bolt, whichever e-hailing technology. So those e-hailing technologies have become part of the solution as a massive public health intervention to get patients their medication through this crisis period.
That's incredible.
Again, the kinds of innovations that we probably would only have dreamt of a short while ago.
Of course, that is so. That, I mean, yeah, they say that like necessity is the mother of invention, but I actually think it's more around uncertainty. Like that uncertainty, even though it's daunting and scary and anxiety, it drives a certain, like it makes the human mind think in the most innovative ways. Yeah. And it's amazing to see that these solutions, as you say, are happening to like solve social complex issues. Transport is something that we've been grappling with and healthcare, we've been grappling with that like for decades in South Africa. And now there's this like petri dish of innovation that's like, people are jumping on board. And I mean, an Uber driver 4 months ago would probably never have guessed that he's dropping off medication to someone in need in like the middle of an area in need. So
and even I think so what's happening in some other geographies, phenomenal. Madagascar identified that women requiring antenatal care are especially susceptible during lockdown periods. Here's what we're going to do. We're going to zero rate Uber or any other e-hailing technology during that period, and we will pay for that.
Wow.
Okay.
Crazy.
So let's just flip that on its head and say, oh, but the costs and all of that. The costs are minuscule compared to the lives saved, the morbidity averted, and all of those costs. And often I think those kind of mental models that we had in our head, the cost, it's going to hold us back. Somebody was joking with us when we try to look at the incremental cost of using Uber, for example, just as a lever for home deliveries for medication.
Yeah.
It's working out to 5 US cents per patient's delivery. And so somebody joked with us and they said, is the cost effectiveness study to study the cost effectiveness of that intervention going to cost more than the actual intervention? It's just like, really, I mean, so I think that it's the opportunity to kind of break our mental mold around what could be done given all of the emerging technologies, the commercial platforms that have been created, and the willingness, I think, of decision makers. I think that's going to be key to actually embrace these opportunities. Will fundamentally shift the way we see healthcare delivery, not in the future, in 2020.
Yeah, absolutely. And I mean, I feel really passionate about hospitality because it has been a large part of my career for the longest time. And, we've spoken a little bit about Ubuntu beds and what we're doing. And we've had, I think this week, we're going to be placing our 200th healthcare worker. Our moonshot goal is 2,500. That's what we believe, that's where we will get to, I guess, like through the next few months. And as we see the peak. And I think that, for us, it is about using, an apartment or a guest house or a hotel that's standing empty close to the hospital, and like offering peace of mind to the healthcare worker who is trying, you know, who's doing their best really to help and to problem solve and to be our hero. So yeah, like and at the end, you know, we're busy fundraising at the moment, and at it's, you know, through all our fundraising, I also think like it's only a little bit, but I feel like we have the potential. It's a leverage, you know, we have the potential to help a lot, because if you can offer a little bit of peace of mind and like a little bit of comfort, then that 5 cents, that whether it's the Uber driver or whether it's like, you know, a discounted apartment or whatever, like that 5 cents is actually worth so much more.
And maybe let's not underestimate that contribution, Kim. So let's just pause for a second here. And I know of this firsthand. And we started off with the discussion about the difficulties that healthcare workers are experiencing, right? And I know of actually very close, our own GP was in the position of having an elderly mother at extremely high risk in his own household, very small kids, and had to make the difficult decision about his exposure to patients and actually getting COVID. Because he was diagnosing 3 or 4 every day. So he knew that he was at extremely high risk, right?
Yeah.
So he moved out. There was an interim arrangement. It was not ideal, but the psychological space he was in, I think I can't imagine, must have been extremely hard. His kids could not understand, they could not see him. When he came home, you know, he was very distant. And so I think, you know, being able to offer some alternative, you know, as your company has done, I don't think we must underestimate that. I mean, I think that, you know, we kind of often look at impact. Let's take one doctor or nurse that's now had the opportunity to recover, had a bit of, you know, space, and is able to come back. How many more 100 patients is that nurse or doctor going to see? And with what spirit and what commitment and what vigor, you know, that person, you know, comes back. So I you know, maybe we're just seeing it as a room. No, I actually think it's giving that individual, like, it's rekindling their commitment, and giving them that space, which, you know, we don't have many tools, but I see this as one absolutely concrete one to do that.
And I think also, like, you know, I guess like we're offering now isolation as well for like positive healthcare workers, because you know, you've talked about the inequality on this call, you know, the fact that you know, that many people in South Africa live in multiple family households, and that isolation is a luxury. I mean, to isolate, you need to have your own bedroom, your own bathroom, and your own ability to make food. So I think that is a luxury, and like what we're seeing is that in time, like in the worst cases, even healthcare workers who are positive will have to potentially go to work. And that's so scary, you know, that like you'll start off with like 10%, 20%, 30% infection, and then eventually the whole hospital will have it. And my parents are both doctors, and they're like, Kim, you know, if we get COVID, you know, we'll isolate if we can, but if everyone's got it, then we must continue. Like, we will continue to practice, because this is our job, you know, this is the line of work that we've chosen. And I think that you know, that protecting family members and offering peace of mind is, I think that it goes a long way, I hope, you know. So
absolutely
cool. So I guess, like, in closing, how do you think, if you fast forward 10 years, like, how would you talk about this time to your kids? Like, how would you describe this crazy world we're living in right now?
Yeah, and I think that, you started off by, or somewhere in our discussion, we spoke a little bit about how there are things we realize out of the necessity that we can and should do, and that it's, unearthing like our latent talents in a way. I mean, I'm super appreciative. My kids actually enjoy my wife's schooling more than they do actual schooling. I think we have a bit of a problem here. And she's actually been enjoying it too. And I'm going, oh, I don't know where this is going to end up. But I also have been thinking about, like, there's almost no industry that will emerge out of COVID untouched. There's, I think our president actually said yesterday, there's no economy that will emerge untouched. But I think that I'm hoping that in 2 years' time, in 5 years' time, in 10 years' time, that what we don't reflect about COVID is only the tragedy, the death, and the suffering that went along with COVID, but rather that in fact was the biggest inflection point in our existence, over the last 100 years. Because I think that will give us the strength to kind of carry through on all of the strength and the hope that we need to carry through on all of these things that we see emerging right now. And I think it will give us the opportunity to kind of do some sort of internal reflection around what have we taken for granted as individuals that was so simple, but we absolutely took it for granted. Kim, on the weekend I was interviewed, and I kind of said, the one thing I've taken for granted, like now, today, I didn't hug my mom enough. And actually, I just wish I could just hug her. I can see she needs a hug, but she's 80. And I'm on the front line. It's just a hug, like, I just took that for granted. Like, I'm trying to make that own commitment that quickly COVID goes and I can hug again. Like a simple thing like that. The fact that we have these family structures that, so Eid Day was difficult for Muslims around the world, right? Like, because we tried to keep to the lockdown regulations. I saw more people on Zoom calls than I see on any Eid Day ever.
Yeah.
And so we connected. Like, I actually see Zoom calls being part of my Eid Day going forward. Like, we can have one big Zoom call. We can still hopefully have our lunches and our dinners, but we can have one big Zoom call and 200 people dial in and we have a blast. And, but I think it's so on the one hand, like, it's really being able to embrace the technology and the lessons. But I also think there's a component of, like, what are we taking for granted in our current existence that we really need to reconnect to? We really need to go back to. That's why I'm here. And, I really need to hold on to that. And maybe my message is too simple. Maybe it's, not as kind of bold or out there as you were hoping for. But I think that we can emerge from this as humanity much stronger, much more optimistic than we came in.
Thank you. I think you've inspired me today. I'm gonna be I'll be skipping around for the rest of the day. I think that those little kernels and nuggets of like hope and humanity are what keep us going, and I think that so many people have slowed down because they've had to, and we've realized we're not immortal, we're vulnerable, we're we're in this together. This is one thing that affects all people, whether you're rich, whether you're poor, whether you're old or young. Like, it will affect you. I loved your words. Thank you for sharing your wisdom with me today. Thank you for being
Thanks for having
such
me.
an inspiration, and for all the amazing work you do. You really are an Abantu for Ubuntu, and I
Wow,
wish
I
you
feel
all the
privileged.
best.
Thank you very much, Kim. And you know, equally, just I mean, the work that you're doing, both through, you know, Ubuntu beds, is having such an impact. And I, you know, my personal experience having asked you to help place a few doctors in need, it's just been exceptional. I've had great feedback on that. But also, just I think these series are amazing, because I think they give us the opportunity to reflect and hopefully share and hear from others about, you know, what we're learning about this. And I actually think it's these kinds of things that we're all going to frame, you know, and come back in a few years' time and go, that was the moment, you know, that that we kind of all had an opportunity to reflect. So thank you.